Bonjour à tous.
Good morning, everyone. Before I begin today, I'd like to say a few words about the arrest of Mr. Camara in Park Extension in Montreal in my Papineau riding. This is a disturbing case. Many questions must be asked, particularly with regard to the authorities involved in this affair. We need to shed light on what happened. My thoughts are with Mr. Camara as well as with the injured police officer. In the last weeks, we've seen that the number of new cases across the country has continued to drop. This is good news, but we can't let down our guard. There's still much work to be done with new variants across the world that we're now seeing here in Canada. We must do everything we can to protect ourselves and to protect our neighbors and friends, but there's still work to be done. While many provinces are getting ready to ease up on certain public health measures, I'd like to give you an update on the various ways that we are fighting COVID-19. Let's start by talking about vaccines.
As soon as possible. And that's exactly why we're focused on vaccines. The temporary shipment delays that many countries are facing right now are a hurdle, but they're one that we were ready for. We knew that short-term delays would be a possibility, so we planned accordingly. But I hear it from all Canadians right now. People are worried. People are tired of this pandemic. They want to know when this winter is going to be over. They want to know when they can go back to everything they've done before. They want to know mostly when their grandparents are going to be safe, when the vaccines are going to come. That's why there's a lot of anxiety and there's a lot of noise going on right now. That's why I want to reassure Canadians that we are on track. In late November, we stood before Canadians and we said that we were confident that we were going to get 6 million doses of the Pfizer and Moderna vaccine by Q1 of 2021. That's the first 3 months of 2021, January, February, and March. We are very much on track to getting those 6 million doses of Pfizer and Moderna by the end of March, as we predicted in November. I speak almost every week with the CEOs of these vaccine companies, and they have assured me that they will meet their obligations, their contractual obligations, to deliver 6 million doses to Canadians by the end of March, which means we are still very much on track for 20 million doses in the spring from Pfizer and Moderna, with more vaccine companies in the process of approval right now. And we will get everyone vaccinated by September. Now, a friend of mine actually shared me the story of how they felt a few days ago when their elderly parents in a long-term care home here in Ottawa got their second dose of the vaccine. He said it was a surprise just how much of a relief it was to suddenly not be afraid for your loved ones. That's a feeling that thousands upon thousands of Canadians are getting right across the country, but we need to get to millions. I know how tired we all are. I know how anxious we are to see our loved ones safe, to see life returning to normal. We feel it too. That's why we are working every single day to make sure that as many vaccines as possible come into Canada as quickly as possible. And yes, the turbulence week over week that we're seeing is of concern, and we're watching it closely and we're staying on it. But let me reassure people, we are still very much on track, as promised, to get those 6 million doses by the end of March, because that's what the vaccine company CEOs keep telling me. And I'm happy to reassure Canadians on that. We are focused on keeping you and your family safe every step of the way. Our team is in constant contact with the top people involved, as well as with our counterparts in Europe. Over the past weeks, I've personally spoken with the CEOs of Pfizer and Moderna, and this week I was on the phone with Pascal Soriot from AstraZeneca. They assured me that they will fulfill all their commitments to Canada. We've worked around the clock to negotiate one of the world's most diverse vaccine portfolio. That's how we have assured more potential doses per person than any other country. In addition to Pfizer and Moderna, 3 other companies have submitted their vaccines for review by Health Canada: AstraZeneca, Janssen, and Novavax. This review process is independent and has the very highest standards to make sure that every vaccine approved in Canada is both safe and effective. On vaccines, I also want to say a few words about COVAX, which is another important part of our overall plan. When wealthier countries invest in COVAX, half of that funding is for doses at home, and the other half is to buy doses for low and middle-income countries. In other words, our contribution was always intended to access vaccine doses for Canadians as well as to support lower-income countries. Through COVAX, pending Health Canada approval, we will receive at least 1.9 million doses of the AstraZeneca vaccine before the end of June. That's in addition to the 20 million doses we've already secured from AstraZeneca. Canada is committed to making sure that the rest of the world doesn't get left behind when it comes to vaccination. That's why we are one of the world's top donors to COVAX. To beat this virus anywhere, we have to beat it everywhere. In addition to COVAX, we've also contributed to other programs specifically designed to help lower-income countries get access to vaccines.
Yesterday, we had our 26th First Ministers meeting with the provinces and territories. And of course, we spoke of vaccines. With regard to the Pfizer vaccine, the number of doses delivered weekly will increase in mid-February. If we count Pfizer and Moderna together, we will receive 6 million doses in total by the end of March, as we've been saying to Canadians since the end of November. We are also preparing for a faster rollout, which will begin in April as expected. In spring, we're expecting to receive 20 million doses from the 2 vaccines that have already been authorized. And this number will be adjusted upwards as we add other vaccine candidates that are currently being studied by Health Canada. Despite the short-term temporary issues that are also affecting other countries, our plan is a solid one, and we will stay the course to meet our goals. Any Canadian who wishes a vaccine will be able to have one by September.
Last week, we also announced new measures for international travel. All international flights are now limited to 4 major airports: Montreal, Toronto, Calgary, and Vancouver. With the support of our airline industry, all flights to and from Mexico and the Caribbean have also been suspended until April 30th. As I told the premiers during our 26th meeting yesterday, our government's priority has always been to protect Canadians. That's exactly what we're continuing to do. The mandatory PCR testing at the airport and the new 3-day quarantine measures will be in place as soon as possible. In addition to these new rules for flying, we're also looking at ways to further strengthen our land border measures. We'll have more to announce on this soon. Pendant que les vaccins continuent d'arriver,
while vaccines continue to arrive, we must absolutely examine, or make use of rather, other tools that are available to stop this virus. Testing must play a crucial role in our strategy, particularly since cases are beginning to drop and provinces are thinking of reopening. Whether in schools, long-term care homes, or workplaces, rapid tests will be an efficient way to prevent outbreaks. I continue the provinces and territories. I strongly I continue to strongly encourage the provinces and territories to use them. For Canadian safety and for the economy as well, we must continue to work to ensure that the number of new cases continues to drop. This morning, we learned that the Canadian economy lost 213,000 jobs in January, mainly part-time jobs in the retail sales sector. Since the beginning of this pandemic, our government has acted quickly to directly support Canadians, workers, and small businesses through programs such as wage subsidies, commercial rent support, or changes we made to the employment insurance regime. We are not letting you down. If you would like to know about the support, you can go to the site canada.ca coronavirus for more information on our different support measures. We will continue to be there for you. If you've lost your job, we're thinking of you, but we have means to help you. We are working tirelessly to provide vaccines as soon as possible. We know that spring is on its way and things will improve. In the meantime, we are here for you.
No matter where you live, our focus is on keeping you and your community safe. On that note, today, I can announce that we have approved a request for federal assistance for Pongassi First Nation in northern Manitoba. The Canadian Armed Forces will begin deployment as soon as possible. They'll be arriving on Saturday at the latest and will be there until February 10th. Once they're on the ground, members of the forces will be providing logistical support, transporting goods and medical supplies, and conducting wellness checks. Just as they have since the start of this crisis, our women and men in uniform are stepping up to the plate. They're doing a great job and making a real positive difference for the people who need it most. Over the last year, we've seen people across the country come together to support each other through this incredibly difficult time. After all, that's just who we are. In Canada, we just help each other out. We learn from our differences. We celebrate diversity, country, and as a democracy. And we will always stand up to protect them. On Wednesday, Minister Blair announced that 13 new groups are now listed as terrorist entities, including ideologically motivated extremist groups like the Proud Boys. These decisions were made after thorough information gathering by Canada's security and intelligence officials, often over months and years. To be listed, a group must meet a high legal threshold. The listing can then help stop their dangerous activities and facilitate criminal investigations and prosecutions. Among other things, this means that under the law, it is now a crime to deal knowingly with the property or finances of these hateful groups. We will continue to do whatever it takes to keep Canadians safe. We will continue to fight hate and violence online, and we will continue to protect our communities and our places of worship. Just last week, I spoke to my friend Rabbi Adam Shire, whose synagogue in Montreal was recently vandalized with anti-Semitic graffiti. He mentioned that enhanced security measures made possible by our security infrastructure program, as well as extremely alert security guards, meant that the alleged perpetrator was caught quickly before he could do more serious damage. Violent extremism has no place in our country. We will always stand up to groups and individuals who use violence to target our fellow Canadians or to attack our democratic systems.
I want to wrap up today by returning to the question of our fight against COVID-19 and specifically vaccines. I know that there is a tremendous amount of anxiety, so let me repeat something. Our plan is working. I want to reassure everyone watching us from home. I know that you are impatiently waiting that everything be over with as quickly as possible. I know that you're impatiently waiting your vaccine. And I know that you are awaiting the vaccine for your grandparents in particularly. We are working tirelessly every day to get through this together. Since the very beginning, we've been here for Canadians, whether it comes to support for workers, for families, or for businesses, whether it comes to border measures, or just being there to help provinces and territories, the people in long-term care homes. We will be there for you, and we will be there with vaccines. We have negotiated for more contracts and more doses than almost any other country, and we are delivering on this plan. As I said in the month of November, we announced that in the first quarter of 2021, we would be receiving 6 million doses of Pfizer and Moderna vaccines. I speak regularly with these two companies. They have reassured us and promised us that they will deliver these 6 million vaccines by the end of next month. We are on track to arrive at the end of this pandemic, and I understand that the ups and downs that we're going through week to week may be upsetting for some people, but I must reassure you, we are heading where we have promised to be by the end of next month. We'll have 20 more Pfizer and Moderna doses this spring, and we'll be adding other vaccine doses from other vaccine candidates as they are approved. We will be keeping our promise that any Canadian who wishes to do so will be able to be vaccinated by the month of September. We are going to get through this. We are continuing to work with you and for you. Summer and the months to come will be better than this winter. Thank you very much.
With a few questions from reporters, then turn back to the front yard for more questions. Operator?
Thank you, merci. La première question est de l'inaudible. La presse canadienne, la parole est à vous.
The Canadian Press, go ahead. Question. With regard to Mr. Camara, you said we have to shed light on this. Are you asking for an independent inquiry into this affair? Answer. I understand that authorities, including the Montreal mayor, Ms. Plante, are reviewing the file. Everybody has important questions about what happened to Mr. Camara. These questions will need to be answered, and I'm fully confident that the authorities will be able to do the work necessary to shed light on this situation.
As we've seen, anyone who has followed the story of what happened to Mr. Camara is really concerned about it. That's why, like the Mayor of Montreal and many others, I think there needs to be full light shone on exactly what happened there. I am confident that the responsible authorities will put in place measures to find out exactly what happened, what went wrong in this troubling situation. It's something that we all want to see.
Follow-up question. You mentioned the police that is continuing its inquiry. What about an independent inquiry? Some people believe that this incident was another example of racism. What do you think? Answer. As I've said since the very beginning, this systemic racism exists in all our institutions. And when we're talking about our police forces in particular, that it is extremely important to ensure that citizens can trust the police. I'm confident that answers to all the questions that people have about this event will be found. Actions will need to be taken if there was anything done that should not have been done or not done properly. I am the MP for the riding involved where this incident took place, and as the Member of Parliament and as a Canadian, I want to have answers. and the processes are in place to provide us with answers. But I think everyone in a place of authority is very convinced that we must have answers to be able to reassure citizens so that they continue to trust and have confidence in our institutions.
It's extremely important to recognize that systemic racism, systemic discrimination exists in all our institutions. And when it comes to police services, for example, that's something that really requires a level of confidence by ordinary citizens in the integrity, in the processes, in the work being done by those institutions to counter systemic discrimination. And that's why when we call for answers as citizens, as the local MP, as I am, as Canadians, we need to be confident that those answers are going to be given clearly and based on facts. So I know the responsible authorities are very aware of the pressure that will be on them to figure out exactly what went wrong and to fully answer the questions of friends and family and citizens who are extremely worried about this troubling incident. I am certainly one who will watch closely to see the answers given on how something like this could happen.
Merci. Prochaine question. Operator.
Merci, thank you. The next question is from Ryan Tumulty of the National Post. Please go ahead.
Yeah, good morning, sir. You said in your opening remarks today that that Canada always expected that there would be disruptions in vaccine supply and that we had a plan for this. I guess I'm wondering, is this the plan? Was this always the plan that we would potentially go through lull periods like this with, just tens of thousands of doses arriving in Canada while other countries pull ahead?
A year ago, there was no vaccine for this new virus that was arriving and ravaging everywhere around the world. We knew that the scientific community, that pharmaceutical companies, that researchers around the world would be working extremely hard to try and both discover and then mass produce enough effective vaccines, ultimately for over 7 billion people. And that was a massive, monumental task. In Canada, we determined that we would do whatever it took, as much as we could, to ensure that Canadians got the vaccines that were so necessary as quickly as possible. And even before anyone started developing or confirming that they had vaccines, we signed vaccine contracts with 7 different potential vaccine manufacturers and ensured that Canadians have more doses per person, potentially, than any other country in the world. And we did that because we knew that there was uncertainty around which companies, would develop the vaccines quickest, which vaccines would be most effective. And we knew that from developing a vaccine to actually mass producing millions and ultimately billions of doses of those vaccines would be a monumental logistical and production challenge. So we made sure that we were creating all the different pathways and relationships that would ensure that Canadians got as many doses as possible, as quickly as possible. And that included also investing in domestic capacity because, as I said many months ago, Canada does not have adequate or even much at all local domestic capacity of producing the vaccines for COVID-19, and we needed to begin developing that, and we have. But throughout, there was an understanding that there would be moments of uncertainty, there would be moments of delays in delivery and production challenges as these various companies scale up. So the plan was to make sure that we had deals with whatever companies landed vaccines first, but also that we weren't putting all our eggs in any one basket, and therefore, even as we were expecting doses in the millions from Pfizer and Moderna, who are the first companies to deliver the vaccines, we continue to speak regularly and pursue through Health Canada processes approvals of other vaccines, AstraZeneca, Janssen, Novavax. We are going to continue to work every day to ensure that as many doses as possible arrive as quickly as possible for Canadians. And that work we've done is why, just like I said last November, we are confident we are going to hit our target of 6 million doses in Canada by the end of March from Pfizer and Moderna. We're going to hit millions, tens of millions more in the spring, and we will have, as promised, every Canadian who wants a vaccine vaccinated by the end of September 2021. Il y a un an, on n'avait pas de vaccin.
1 year ago, we did not have a vaccine. We knew that as a planet, we would have to develop effective vaccines against this new virus and then produce billions of doses of these vaccines to distribute to the world population. We knew that this was a monumental challenge. And in Canada, we decided that, well, we know that diversity is a strength. We decided to seal 7 agreements with vaccine producers. At the time, we didn't know which would arrive first, which would be the most effective, which company would be able to produce the billions of doses the fastest. So from the very beginning, we diversified our vaccine portfolio. At the same time, we invested in vaccine production capacity here in Canada. We knew that this would be a long-term solution either for this pandemic or for future pandemics. As soon as we could announce to Canadians in November last year that in the first quarter of this year, we would receive 6 million Pfizer and Moderna vaccine doses rather, I am pleased to be able to say today we kept our word. We will be receiving those 6 million doses according to what the CEOs of these companies are telling us. 6 million by the end of next month. But we're not relying only on those 2 vaccines, which are very effective and which are beginning to arrive. We're also working with AstraZeneca, Janssen, Novavax, and other companies to approve their vaccines and get them here as quickly as possible. Every single day, we are working to increase the number of doses that will arrive in Canada so that we can get through this as quickly as possible. That's why we are convinced that our plan works. We will be able to meet our target for the end of March, and we will be able to vaccinate anyone who wants to be vaccinated by September 2021.
Yeah, sir, I'm wondering too about the AstraZeneca vaccine. The majority of that company's production is in India, a country with which we've had tense relations at times. I'm wondering if you're concerned about this sort of vaccine nationalism that we've seen to a degree in Europe cropping up when our AstraZeneca vaccines are set to be shipped from India.
The Health Canada processes are currently underway in terms of approval of the AstraZeneca vaccine. I spoke with the CEO of AstraZeneca, Pascal Soriot, just a few days ago, and he very much assured me that we are on track to receiving the 20 million doses committed to by the end of June, I believe. We're going to continue to be on track. We're going to continue to work with partners and countries around the world to not just get the vaccine doses we've signed for, but look to try and achieve more. Every country in the world is trying to get their citizens vaccinated as quickly as possible, but Canada will continue to be at the forefront, both in working with vaccine companies and ensuring that the great contracts we signed from the very beginning will continue to be respected.
One more question on the phone. Operator.
Thank you, merci. La prochaine question. The next question is from Justin Lane, freelance. Please go ahead.
Good morning, Prime Minister. evidently, the spending that has come out of the government of Canada over the last year has been unprecedented. The number of contracts the government of Canada has undertaken with suppliers, domestic and foreign, is extraordinary. Through that, the government has been reticent to reveal basic details about who's applied for funding, who's awarded it, and why they've gotten it. Do you feel like you owe a greater level of transparency to the country and to the journalists who cover your government so that they may more fulsomely figure out exactly what's going on and how these decisions are being made?
My first priority, Justin, is and always will be keeping Canadians safe and healthy and getting through this pandemic by any means possible. That's been our focus from the very, very beginning. That's why we made the commitment to be there for Canadians, whatever it took, however long it takes, and we'll continue to do that. We've reached out to boost domestic production of PPE and scientific solutions, treatments, and vaccines. We've reached out to countries around the world to ensure that we're getting the supplies we need to get through this. We're continuing and continually looking to make sure we're doing everything we can to get Canadians through this. Now, part of getting through this well is maintaining Canadians' confidence in their institutions, confidence in their government's ability to continue to deliver for them while we're asking them to do difficult things like sacrificing their weekends and their family times and their birthdays by staying at home. But that reassurance of Canadians that we are doing everything necessary to keep them safe is at the heart of what this government is focused on. And therefore, transparency as a measure of boosting confidence continues to be extremely important for this government. But every step of the way, we're always trying to focus first and foremost on delivering for Canadians right now while we're in this pandemic.
Follow-up, Justin?
Right. So, but your government has still refused to reveal details or waive confidentiality, even around some of the domestic funding decisions. In previous governments, journalists have had the power to use access information requests to get them that information. You yourself had promised, once upon a time, to reform access information to make it more usable by journalists, including in an interview with me 6 years ago, you promised point blank that your office would be covered, as well as your minister's offices, would be covered by access information requests. That hasn't happened. Were you lying back then, or were you naive to the realities of governing?
Justin, you may not have noticed, but over the past couple of years, we actually made significant improvements to the access to information regime. We updated it significantly, strengthened the provisions, strengthened the powers of the Information Commissioner, and we'll continue to work and respect fully the extremely important work that journalists do to shine light on what government's doing, to keep Canadians informed, and indeed to make sure that our democracy continues to work. I thank you for the work you're doing. I thank you for the pressure you keep pushing on us, because we need to continue looking to do better and increase Canadians' confidence in our democracy. We've seen what happens when leaders don't respect the media, don't believe in transparency and openness. That's why we've done more on transparency and openness than previous governments have. But as you point out, there's always more we can do.
Bonjour, M. Trudeau. Louis Blouin de Radio-Canada. Le gouvernement du Québec continue de vous blâmer.
The Quebec government continues to blame you with regard to vaccine procurement. They have the impression that they have a new car but no gas for it. Do you take responsibility for the disruptions that you spoke of just now? Are the provinces scapegoats? Answer: I understand that the provinces are facing tremendous challenges, whether it comes to closings, citizen fatigue, pressure on workers in the healthcare system, for example. as well as tragedies that are continuing despite everyone's best efforts in our long-term care homes. I understand there is tremendous frustration, and this is what citizens feel across the country. But as I've said since the very beginning, we are here to help people, to help provinces, to help Canadians, and we are going to continue to work with the provinces. I understand rather that people are frustrated that vaccines didn't arrive yesterday. Everyone wants to be vaccinated within a week and a half, but unfortunately, global production does not allow us to do so. We made promises to Canadians in November. We promised provinces and all Canadians that we would be receiving 6 million Pfizer and Moderna vaccines by the end of next month. We are en route to do so. The CEOs of these two companies have said, yes, we will deliver. You will get your 6 million doses. It's true that from week to week, there can be challenges. The Pfizer facility in Belgium is currently updating its production line to be able to increase production by 1 million, but that's causing delays in Pfizer's deliveries. This is something that's unfortunate. Obviously, we want to have as many doses possible as quickly as possible. Every day without vaccines means that the most vulnerable people, our seniors, are more at risk. But we're doing everything we can to get those doses as quickly as possible. All the work that we're doing, that we have done to secure contracts with a number of different companies, for a large number of doses, all this will pay off, and we will be receiving hundreds of thousands of vaccines every week, millions in the spring, and everyone will be vaccinated before the end of September 2021.
Saying that you're confident that Pfizer and Moderna will deliver these 6 million doses by the end of March. I'm wondering, though, if they don't, in the contracts that you've signed with these companies, are there penalties? Are there incentives for them to deliver? Is there any recourse for Canada if they don't deliver these 6 million?
I have had direct conversations with the CEOs of both Pfizer and Moderna who have repeatedly assured me that Canada will receive those doses that we were promised, those 6 million doses, 4 million from Pfizer, 2 million from Moderna, by the end of next month. The Q1 delivery schedule was something we announced at the end of November last year for 6 million doses of Pfizer and Moderna, and we are very much on track. Those doses will begin to accelerate and come in the hundreds of thousands in the coming weeks to ensure that we hit those targets for the end of March. But on top of that, even as we're moving forward on Pfizer and Moderna, I'm also speaking regularly with the folks at AstraZeneca. Health Canada is working on AstraZeneca, Janssen, and Novavax approvals. We're working to procure different vaccines to come into Canada as quickly as possible, including through the COVAX facility, which Canada was one of the leaders of and one of the early adopters of and one of the largest investors in, to ensure that we were doing and continue to do everything we can to keep having Canadians' backs. I mean, that's the promise I made to Canadians many, many months ago, standing here in our very first press conferences. We would be there to support Canadians. We'd have your backs. Well, we did that on income supports. We did that on borders. We're doing that with support for the provinces, with the Red Cross and the Armed Forces. We're continuing to have your back every different way, including on vaccines. We know vaccines are the way we get through this. That's why every day we are working and we continue to have your backs, and we're going to reach our targets, and we're going to get everyone vaccinated by the end of September.
Prime Minister Michael Landsfield, Canadian Press. You talk about having Canadians back. We've seen the January jobs report this morning. You mentioned you had some comments in French we've already heard. You've talked about what you've done in the past to have Canadians back and how important that is. But what specifically can your government do in the future to have Canadians back, to help out in some way? Is it more rapid testing capacity? Is it more spending? What can you do? What more can you do to keep workers employed, to help those, and especially in Ontario and Quebec, who have been hit so hard while they wait for vaccines and your jobs relief to kick in? What more?
The January job numbers are difficult for families across the country who lost their jobs. We knew that the further lockdowns that provinces had to take to get the numbers down, which we're seeing right across the country, the numbers are heading in the right direction. But we're not at the end yet. We know we're going to have to continue to hang in there. But that's why from the very beginning, the federal government worked hard to make those difficult decisions by the provinces a little bit easier by being there to directly support workers who are laid off because of COVID-19. First with the CERB, now with enhanced EI. We've continued to be there for small businesses with business accounts like the CIBA that gives interest-free loans and tremendous support so small businesses can hang in there while we wait for vaccines. We knew this winter was going to be a difficult one, that we were going to have to keep being there for each other, which is why, as far back as last September, we extended our business supports, our income supports, all the way through to the end of next summer, because we knew there would be challenging times coming up. And we're going to continue every single day to look at ways to continue to support vulnerable Canadians who are being affected by this pandemic and its many, many impacts. Because that promise to be there for Canadians is one that this federal government takes extremely seriously. But 9 out of every $10, 8 or 9 out of every $10 spent on pandemic supports during this pandemic has come from the federal government, not provincial or territorial governments. We are there to support Canadians, and we will continue to be until we get through this, with income supports, with vaccines, with health measures, with the supports that people need.
Prime Minister Michael Couture with Global National. Since last we spoke to you, Global News has reported on very serious allegations of inappropriate behavior by former Chief of Defense Staff Jonathan Vance towards female subordinates. And I wanted to know, what do you make of those allegations?
First of all, obviously, the new Chief of Defense Staff, Art MacDonald, has announced there will be a review into this specific situation. But I can say that from the very beginning, this government has made it very, very clear that everyone in this country, particularly working for the government, particularly working for the Canadian Armed Forces, deserves a safe and secure work environment free from any harassment. That's why whenever allegations or reports are brought forward to this government, we always take every necessary step and follow the full procedures, including all the strengthened procedures that we've brought in over the past years.
Just to follow up on that, multiple senior government and military sources have told Global News that they knew of the concerns about inappropriate behavior by General Vance for years. The Privy Council Office was made aware of concerns, but didn't receive, they said they didn't receive any information that could have enabled further action. Yet, despite all of that, a senior government source told you and your office you were unaware, they told us, that you were unaware and your office was unaware of these concerns before they were reported by us at Global News. I just wanted to know, how is it possible that this was not on your radar? And do you consider it a failure that you were not informed of these allegations, given that they involved someone so senior?
Obviously, we take all of these allegations, or any allegations around misconduct or harassment, extremely seriously, which is why we've strengthened the processes in place in government, and every step of the way we follow those processes to the letter. It is extremely important to move forward on ensuring a safe work environment for everyone in this country, and the government will continue to do everything we need. Nous prenons extrêmement au sérieux le droit de tous les
We
Canadiens
take the rights of every single Canadian, the right to work in a safe workplace free of harassment. We take this very seriously. That's why we have implemented measures upon arriving in power to prevent this type of harassment. When there are allegations, our government always takes the necessary steps and follows the procedures that are in place to ensure that there is a follow-up. With regard to this specific case, I can say that the Chief of Defence Staff, Art MacDonald, has asked for a review of the situation.
Prime Minister, Krishna Najikoti, CTV News. Yesterday, the Parliamentary Secretary to the Procurement Minister said that Canada took the second best option by buying vaccines from countries abroad instead of making vaccines domestically. Can you tell us why all the major pharma companies rejected making vaccines in Canada?
I think we all understood that the need to get vaccines to get through this had to be the absolute priority for all Canadians and for our government. That's what we focused on. That's why we signed more deals with more different companies than just about any other country for more doses for Canadians than any other country. Now, at the same time as we were signing deals internationally, we also made investments to stand up domestic capacity, similar to what we did with PPE. But obviously, the lack of pharmaceutical production capacity in Canada is something that takes a little longer to rectify. And that's why we made investments as of last summer in production facilities in Canada. But ultimately, Canadians expect to get effective vaccines as quickly as possible, and that's why we cast our net extremely wide with both international contracts and domestic investments. I know everyone is looking forward to getting those vaccines into their arms as quickly as possible, and more precisely into the arms of their loved ones, particularly elderly Canadians. That's what we remain focused on. From the beginning, we said we'd have Canadians' backs. That's exactly what we're doing on vaccines, on income supports, on the borders, on support for the provinces, on everything that we're doing. We're going to get through this together. We're working every day to get more vaccines to Canada, and we're very much on track to those 6 million doses by the end of next month that we committed to last year, and to having everyone vaccinated by September.
Question inaudible. Answer. I know that other ministers will be here for the next press conference. Thank you very much.
Hello, an update to everyone. Please make sure your cameras are turned on. Thank you. Bonjour à tous, bienvenue à la conférence de presse d'aujourd'hui.
Welcome to today's press
welcome
conference.
to today's press conference. Monsieur Duclos, la parole est à vous.
Mr. Duclos, you have the floor.
Bonjour tout le monde.
Hello, everyone.
Good morning or good afternoon, everyone, depending on where you are in Canada. Thank you for joining us. I am in the company today of Minister Algabra, who is Minister of Transport, Minister Blair, Minister of Public Safety and Emergency Preparedness, Minister Aidu, Minister of Health, Dr. Theresa Tam, who is Canada's Chief Public Health Officer, and Dr. New, who is Canada's Deputy Chief Public Health Officer. Each of those colleagues will speak in a moment. Before I turn to them, let me summarize briefly what the Prime Minister said just a few moments earlier. Tout d'abord, il a rappelé que le plan
First of all, he reminded us that the vaccine plan for Canadians is going ahead. There should be 6 million doses received by the end of March, and the target of vaccinating every Canadian by the end of September as well. More than 1.1 billion, rather 1 million doses of vaccine have been delivered to provinces and territories. In Quebec in recent weeks, we have been able to vaccinate all residents in long-term care homes, as well as a good proportion of frontline healthcare workers. He also reminded us that we, and he in particular, are in regular contact with the CEOs of vaccine providers, vaccine makers, that is. And we are actively working with the 3 other vaccine companies whose vaccines are being studied by Health Canada. He mentioned the job losses in retail sales, in the retail sales sector, which was a number published by Statistics Canada this week. He mentioned the support that's available, job support, business support for Quebecers and Canadians who need this to be able to get by. These job losses, of course, would be even worse without the wage subsidy that not only helps maintain jobs, but helps us get through this crisis once the health situation is better.
Turn happily to Minister Agabra, Minister of Transport, for his remarks.
Thank you very much, Minister Duclos. Hello, everyone. Over the past year, Transport Canada has been working alongside the Public Health Agency of Canada, industry, and other health experts to put in place a robust, layered system of measures to protect Canadians, including those working in transportation and in shipping, and those who must travel for essential purposes. Our goal is to reduce further introduction and spread of COVID-19 and new variants of the various into Canada, and to keep essential goods and our economy moving. The measures we bring forward are always informed by the latest science and data and the guidance of public health agencies. In the aviation sector, these measures have included mandatory face covering, health checks, temperature screening, and restrictions on international travel, including fewer Canadian airports receiving international passenger flights. Last month, new pre-departure testing requirements for all international travelers came into effect. Now, all travelers must show a negative COVID-19 test result taken within 72 hours of their flights to Canada. These measures are working. Over 5,000 individuals have been denied boarding to Canada due to not being able to show a negative COVID test, or refusing to wear masks, or having elevated temperatures. The positivity rate of international travelers is low, approximately 1 to 2%. However, each new case of COVID-19 is one too many. That's why since March of last year, we've enforced some of the world's strictest border measures and restrictions on non-essential travel. By traveling for non-essential reasons, you are putting yourself, your community, and our frontline and healthcare workers at risk. As we've emphasized over and over, now is not the time for unnecessary travel. The health and safety of Canadians will always be our top priority. However, we recognize that a strong and a competitive air transport industry is vital for Canada's economic recovery. We are committed to helping the aviation sector, and we continue to work with Canada's major airlines and airports to ensure we provide the right and necessary support. What we have is a comprehensive plan. We will continue to take action whenever and wherever through targeted measures to keep goods moving, to keep our economy moving, and to protect Canadians. Thank you. And now I'll pass it on to, I think, Minister Blair.
Thank you very much, Minister Alghabra, and good afternoon, everyone. I'm very pleased to join you here today from my home, which is located in the traditional territory of the Mississauga of the New Credit. Last week, as my colleague has stated, we announced additional measures to keep Canadians safe and to help reduce non-essential travel outside of Canada. I'm very grateful for the work of Canadian Airlines, who have agreed to suspend all flights to and from Mexico and the Caribbean countries until April 30th. We are very appreciative of their support in making this very difficult decision. All other international flights are now being funneled to our 4 main airports in order to ensure that we have the proper controls in place to respond to the emerging variants and to implement our recently announced requirements. And as Mr. Alghabra has said, air travelers must now produce a valid COVID-19 molecular test before flying home, and they will soon have to take another test upon arrival at their own cost. These measures have been designed first and foremost to protect Canadians and to curb the spread of COVID-19 and its emerging variants. We also hope that it will have the effect of disincentivizing non-essential travel outside of Canada. And to that end, it's very clear that Canadians have heard the message that now is not the time to travel. And since the introduction of the new requirements of proof of a valid COVID-19 test prior to boarding, there has been an overall 46% drop in international travelers coming to Canada by air. Last week, I also noted that we will be taking additional significant measures at our land borders. And I'd like to take a moment to explain some of the complexity that we are dealing with at our land borders. As Minister Alghabra explained, we've been able to consolidate international flights to 4 main airports located in large urban centers in Montreal, Toronto, Calgary, and Edmonton. But with respect to our land borders, we are dealing with a very different environment and a more complex set of circumstances given the size of our country and the length of our border. We share a border with the United States stretching nearly 9,000 kilometers. We have 117 land border crossings, both in large point of entries and some very small and remote ones. All Canadians arriving at those points of entry, as well as permanent residents and Indigenous people, have a legal constitutional right of entry. But of course, there can be consequences for failing to comply with the requirements that we have put in place to control the spread of COVID coming across our borders. Foreign nationals who are unable to comply with those requirements are turned back. And it's also important to recognize that less than 5% of the people crossing at land border entry points across this country are coming for non-essential purposes. With close to $2 billion in trade with the United States happening each and every day, essential goods still need to be transported across that border while minimizing any slowdowns. We have done, I believe, excellent work to ensure that produce, essential goods, and our goods are able to get to market across that border and the movement of essential workers. But these challenges require that we work diligently with all of our partners, including the United States, to make sure that our land border measures will be effective. Some of the new measures that we are working on to ensure the safety of people entering our country include measures that may require all arrivals of non-essential travels at our border to have taken a COVID test 72 hours before seeking entry. And as I've indicated, foreign nationals who do not have that test will be turned back. And at the same time, commercial truckers will remain exempt to ensure that supply chains, essential services, and support for critical infrastructure are not adversely affected. We're working hard to stand up additional testing requirements for land travel. All travelers, including those identified exempt, will still be required to wear a mask in public settings, maintain physical distancing, respect the public health guidance of the area they are traveling, and at all times comply with Public Health Agency of Canada orders for quarantine. I want to advise Canadians who are concerned about the implications of whatever new requirements we may put in place could have on their return to Canada, particularly for those Canadians who are currently in their winter residence and have been for some time. I want to assure them that we will provide them with ample notice of all new requirements to ensure that they are able to comply. And at the same time, I want to assure them that the measures we're putting in place are for their protection and for the protection of their friends, families, and communities to keep them safe. The measures that we will implement are intended to be workable and to protect Canadians. We will examine all of the ways in which we can do that most efficiently. In the meantime, I also want to remind Canadians that the border measures that we have put in place remain among the strictest in the world. We have banned all non-essential flights to Canada and all non-essential travelers. We have implemented strict new quarantine conditions so that everyone returning to Canada who is not exempt is required to go into quarantine. And I believe quarantine has been our strongest measure. No matter how you enter Canada, even if you have proof of a valid test or that you have been vaccinated in another country, the mandatory 14-day quarantine will remain in place because it is our most effective tool. Health and law enforcement officers will be in regular contact with travelers to ensure that they are following the quarantine orders. And we are working very closely with our provincial, territorial, and municipal partners to enforce all of these measures. I want to remind the vast majority of Canadians are complying with these quarantine requirements, and we are grateful and we thank them for the measures that they are willing to themselves and their communities. There are a few who are non-compliant and disregard the orders, and I would remind them that breaking quarantine is a serious act and it can result in serious consequences. The enhanced border measures is also being reinforced by enhanced presence of border services and public health officers at our borders to ensure that travelers understand all of their obligations. We will continue to support and manage supply chains on both sides of the border, and we will continue to collaborate with our partners in the United States to strengthen our border measures and doing everything that is necessary and possible to keep our communities safe. Thank you very much.
Dr. Rideau?
Thanks very much, Minister Duclos. Today, I just want to remind community organizations across the country of new available funding to help increase vaccine uptake in specific communities. This available funding is in the total amount of $30.5 million. And as we see vaccinations begin to roll out across the country, we're very focused on making sure that everybody understands the benefit of vaccination, including in communities that sometimes have more skepticism about the value of vaccination. And so this investment will help ensure that communities and public health stakeholders across the country can design approaches that include education, that include information sessions, a variety of different innovative ways to reach people sometimes who are skeptics of vaccination or perhaps vaccine hesitant. We know that we are on a good path with vaccination. We anticipate that by the end of September, every Canadian who wishes to be vaccinated will have access to vaccines. And so it's very important that we continue to reach into communities that may not have the same exposure to public health messaging in ways that are culturally appropriate and relevant. And finally, on the new measures at the border, I will just say that I want to thank the hotel industry for their collaboration and their focus on this initiative. Our officials have been in touch with the Hotel Association to hear their feedback. We have committed to continuing to work with them to provide additional clarity as we move forward. And there is a new webpage for information where hotels can get information about how to participate in the quarantine process. And we'll have more to say in the days to come.
Thank you very much. Can I now turn to Dr. Tam?
Thank you, Minister Duclos. Bonjour à toutes et à tous. There have been 793,734 cases of COVID-19 in Canada, including 20,513 deaths and less than 48,000 active cases, representing a 30% decrease in active cases across the country compared to 2 weeks ago. And over the past 7 days, there have been an average of 3,947 new cases reported daily, as case counts continue to decline and many provinces reported over 15% fewer cases compared to last week. This is definitely good news for some of the most heavily impacted areas of the country. But there is still reason for caution, as some areas saw more modest reductions or small increases in activity. Likewise, even with a steady 2-week decline, case counts are still about double what they were at the peak of the first wave. So the easing of restrictions will need to be done gradually and cautiously. As well, there is a continuing concern in Canada and internationally around more transmissible virus variants. To date, provinces have reported over 242 cases of the B117 variant, with New Brunswick and Saskatchewan reporting their first detections this week, while the number of B1351 variant remains at 13 cases. Despite the cautions we've grown accustomed to hearing with our good news, we are assured that our efforts are having an impact, and thankfully, the gradual decline in severe outcomes continues. Over the past week, the average daily number of people with COVID-19 being treated in Canadian hospitals has declined by over 10% to around 3,600, with under 740 in critical care, and fatal cases have dropped by over 15% to 121 deaths being reported each day. As each day brings us more headway against COVID-19, let's hold fast to the measures we know are working. The past weeks of our collective sacrifice has made a difference, reducing illnesses, saving lives, taking the pressure of our healthcare workforce, and building out a longer runway for vaccines access to expand and begin to work for all Canadians. Let's keep working together and moving forwards with our best effort. This weekend, many will be watching and rooting for their favorite Super Bowl team. Like many events and celebrations during COVID-19, we need to limit in-person contacts to our immediate household. And by connecting with others virtually, we can still enjoy the Super Bowl, but without the super spreader. Thank you.
Thank you so much, Dr. Tam. May I now turn to Dr. New?
Merci, Ministre Duclos.
Thank you, Minister Duclos. Hello, everyone. There have been 793,734 cases of COVID-19 in Canada, including 20,513 deaths and less than 48,000 active cases, representing a 30% decrease in active cases across the country compared to 2 weeks ago. Over the past 7 days, there has been an average of 3,947 new cases reported daily, as case counts continue to decline, and many provinces reported over 15% fewer cases compared to last week. This is definitely good news for some of the most heavily impacted areas of the country, but there is still reason for caution, as some areas saw more modest reductions or small increases in activity. Likewise, even with a steady 2-week decline, case counts are still about double what they were at the peak of the first wave, so easing of restrictions will need to be done gradually and cautiously. As well, there is continuing concern in Canada and internationally around more transmissible virus variants. To date, provinces have reported over 242 cases of the B117 variant, with New Brunswick and Saskatchewan reporting their first detections this week, while the number of B1351 variants remains at 13 cases. Despite the cautions we've grown accustomed to hearing with our good news, we are assured that our efforts are having an impact, and thankfully, the gradual decline in severe outcomes continues. Over the past week, the average number of people with COVID-19 being treated in Canadian hospitals has declined by over 10% to around 3,600, with under 740 in critical care, and fatal cases have dropped by over 15% to 121 deaths being reported each day.
Donne des résultats positifs chaque jour, continuons d'appliquer des mesures
As each day brings us more headway against COVID-19, let's hold fast to the measures we know are working. The past weeks of our collective sacrifice have made a difference, reducing illnesses, saving lives, taking pressure off our healthcare workforce, and building out a longer runway for vaccine access to expand and begin to work for all Canadians. Let's keep working together and moving forward with our best effort. This effort, many people will be watching and rooting for their favorite Super Bowl team. Like many events and celebrations during COVID-19, we need to limit in-person contacts to our immediate household. By connecting with others virtually, we can still enjoy the Super Bowl, but without the super spreader. Thank you very much.
Merci beaucoup, Dr. New.
Thank you very much, Dr. New. We'll be happy to take your questions now.
Merci. Nous allons donc procéder aux questions
We'll go
au
ahead with
téléphone.
questions by phone.
Journaliste
Each
a une
journalist
question et une question de
may
suivi.
ask
We will
one
now
question
go
and one
to
follow-up
questions
question.
on the phone. For one question and one follow-up. Opérateur, première question.
Thank you. Merci. The first question is from, la première question est de Rachel Haynes from CTV News. Please go ahead. À vous la parole.
Hi there. Rachel Haynes here from CTV National News. I just want to go back to some of the vaccine discussion that we are having. The Prime Minister spoke today about how every Canadian who wants one will be vaccinated by the end of September, and yet Minister Rideau said that there will be enough vaccines by September to vaccinate everyone. So can you please clear this up? Is it going to be every single Canadian who wants one at the end of September will be vaccinated?
Yeah, listen, I'm sorry if I was unclear. The goal that we have is that every Canadian who wishes to be vaccinated will be able to do so by the end of September.
And is that something that you've spoken to about the provinces on how feasible that really is? Because even here in the city of Ottawa, they've started talking about how their rollout, mass rollout, will start at the end of August. So even if the provinces are delivered these vaccines, which at this point, I'm not sure how we can trust given all the delays, but have you even spoken to provinces about if they will be able to vaccinate everyone on this timeline?
Thanks, Rachel. Well, yes, in fact, the work that we've been doing through the Public Health Agency of Canada under the leadership of Major General Danny Fortin is to do that coordination with provinces and territories first on this early stage, as you know, in the Q1 stage with Pfizer and Moderna, getting provinces and territories ready in December and, ready to receive and distribute those vaccines, including to remote communities, has been a focus of their work collaboratively. But moving forward, the planning has begun and is well underway for the second and third quarters, where we anticipate we will have a volume of a variety of vaccines available in Canada and available to be distributed by provinces and territories. So that work is ongoing at the officials level and certainly has been discussed at the ministerial level as well.
Merci. Thank you. Next question. Prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Christian Noël de Radio Canada. Please go ahead.
Radio Canada, please go ahead. Question.
Bonjour à tous.
Hi, everyone.
La question est simple. Vous répétez
My question is simple. You're repeating that we're going to have all the doses promised to us by March 31st. If the companies do not deliver, what can Canada do to force them to do so? Answer. Thank you very much for your question. Let me remind you quickly what the working relationship has been since the very beginning. We have an agreement with 7 different companies. We've already seen some results since December. The 2 companies we're currently working with for delivery of vaccine and administration, I mean Pfizer and Moderna, are companies that will deliver the first vaccines, that have been delivering the first vaccines to Canada. Canada was the second country to receive them. We've had very good relations with these companies for a long time. And I'll just point out that the Public Health Agency of Canada and Health Canada have an excellent reputation internationally. Let me interrupt you, Minister. You're avoiding the question, as Mr. Trudeau said. I understand that we have a good relation with these companies, that we're in contact with them, but in the contracts, are there penalties if they don't deliver on time? Answer. There's a clear target and commitment that the Prime Minister reminded us of today. We speak every day, and by the end of March, the commitment has been made to deliver 6 million doses. We've been very transparent with you and with Canadians on this. Follow-up question. Answer. Clearly, you don't have any intention of answering the question. Canadians do not have the transparency they require. With regard to the contracts, do these contracts foresee the option of receiving other vaccines from other companies before the end of the first quarter? Answer. Excellent question. Ms. Anand has already responded. There are 1.9 million doses coming by June with the COVAX agreement, which we are all aware of by now, as well as the 20 million doses from AstraZeneca in a bilateral, agreed upon in a bilateral agreement. Some of those doses could arrive by the end of March. It will depend on the independent approval method at Health Canada.
Next question.
Thank you. Merci. The next question is from La prochaine question est de Mia Robson from the Canadian Press. Please go ahead. À vous la parole.
Yeah, Dr. Tam, Dr. New, this is probably best directed at you. You've said many times that although the numbers are going down and we have reason to sort of think that that's good news, that we need to sort of continue to buckle down and do what we've been doing. But I'm wondering if we know yet or have any sense yet of at what point our vaccination rate is going to allow us to lift some of at least the lockdown restrictions and sort of move to more just masking and social distancing without the stay-at-home orders. When do we have a sense of how many people have to be vaccinated before that can start to happen?
Well, as I think you can appreciate, these vaccines are pretty new, and we have different vaccines coming on board with potentially different characteristics as well. So I think what I'm trying to do is monitor the data itself. So as provinces begin to vaccinate, to determine what the vaccine effectiveness has been. So there are essentially evaluations or vaccine effectiveness surveillance that are at play. So that's really important so that we can judge how these vaccines perform in the context of the Canadian population in the field. And Canada is a vast country as well, so we would ideally like to see that data from across the country. One of the first pieces of data we'll be looking for, of course, is the impact on the long-term care facilities, the seniors, and see if that has any impact on hospitalizations and on deaths. So that'll be one of the first indicators. But because we do not know if the vaccines are good at reducing transmission of the virus or asymptomatic infection, it is actually really difficult to say what point that would be. But I do think that, we just have to keep week by week monitoring as vaccines roll out what that real-time impact is. And I will be looking towards the United Kingdom and Israel and other countries for some of those signs as well. And then our modelers are also hard at work right now, trying to input these evolving parameters into a model together with the public health measures to see if they can give us some forecasting. But right now, it's a matter of just watch the space, and hopefully we'll be able to provide some more of that information in the near future.
Okay, I guess that sort of answers my follow up a little bit in terms of when that would happen. But the other question I have is, I don't know if it's for you or for maybe Minister Rideau, in terms of vaccine hesitancy, what data have we tried to collect on how much hesitancy exists, what is causing that, and if it's different things, are there different things that are causing people to be afraid of the vaccine depending on where you live or your background? What data do we have on that specifically?
We can't hear you, Minister.
Well, thanks, Dr. Tam. I was just saying in response that I'll just generally say that we do actually track data on appetite for vaccination, not just in terms of the new COVID vaccination, but certainly influenza vaccination and other vaccination across the country. And that's an ongoing process that the Public Health Agency of Canada is involved in. And then there are a variety of different reasons why people might be hesitant. But I will turn to Dr. Tam because she works extensively with NACI and others on this very issue.
Yes, and there's a number of surveys and tools that's been tracking the Canadian population in terms of their intention to get the vaccine and the underlying reasons for why they would or would not. Some of the studies are actually carried out by the Privy Council Office, where there is a behavioral insight team. We do know that the intention for Canadians to get the vaccine is actually quite high, and I think has improved since we started the vaccine campaign itself. And the majority, I would say, I think is now over 70% of people do intend to get the vaccine, but there's a proportion of these that don't want to get it straight away. Of course, there's not enough vaccine for everybody to get it straight away anyways. But when they get the turn, they should be lining up for the vaccine. And I think there's a number of different perspectives. One is that there's a number of people who just have basic questions about the vaccine in terms of clarifying that the rapid development of the vaccine does not mean we've compromised safety or effectiveness. Those are some of the really key questions. People have questions about the new technology, etc. So we've been trying to answer those. There are, of course, there's actually interesting piece of data that indicates that people who get the information from social media and from peers and different sort of Facebook groups, etc., are more likely to be vaccine hesitant. So I think whereas people who may get their information from mainstream media or from other credible internet sites are less likely to be vaccine hesitant. So for that, we know then we have to work with the internet and social media companies. And that has been happening with Facebook, Google, YouTube, and others to direct people to the correct information. Another aspect is healthcare workers. There's some statistics showing that some healthcare workers still have questions about the vaccine and that they, not all of them have made up their minds to take it. And so we've been working with health professional organizations in order to help the education and the provision of information to healthcare providers. The latter is really important because, in fact, the Canadian public look towards the healthcare providers to get that reassurance, and their vaccine confidence are boosted if we enable our healthcare workers to provide information to them. But we do have behavioral insight that also shows that if we enable key influences on social media, and I just interacted with a very big group of religious leaders, for example, then we can boost that vaccine. monitoring that really carefully. There's about probably 10% of people who just says, we are not going to get the vaccine, 10 to 12%. Others we can absolutely work with. Look at our seniors. They're getting vaccinated. The vaccine so far has been safe with no safety signals. So I think that's actually a really good way of boosting vaccine confidence, is seeing other people get vaccinated.